Thank you, Kevin, and good afternoon to everyone. First of all, let me take this opportunity to congratulate the Northwell team and specifically Michael Dowling on having led a remarkable period in history for Northwell, who I understand handled more COVID patients than any other system in the United States. Quite an achievement. Michael, of course, we wish you well. Let me take this opportunity now to introduce Kevin Lobo. Kevin has been the CEO of Stryker for almost a decade. By the way, Kevin is currently the chairman of ADVA, which is the Medical Manufacturers Advisory Board, the trade organization, and is a leading, Stryker is a leading manufacturer of medical technology products, quite well known as an innovative company, primarily in the orthopedics, medical and surgical device arena, neurotechnology, spine surgery arena. So we're in the presence of a CEO who's actually seen quite a lot since the middle of March. My company, Henry Schein, is the largest provider of products and related services to office-based healthcare practitioners. That's dentists and physicians, urology centers, renal dialysis centers, cancer centers, surgery centers, etc. Many of our customers obviously were on the front line, triaging patients, treating patients so that they would not necessarily have to go into the hospital. To me, there were four major neon lights takeaways from this terrible period, the coronavirus period, when we had an economic meltdown, a healthcare meltdown, and coupled with a social meltdown in many parts of the world. The four areas were, number one, leadership in business. Today, I think it is fair to say that the public expects business to be much more committed to the business itself, and that business is no longer the pure business of business. Moral leadership is expected. Second, I think it is also very clear that digital transformation took place in a massive way, advancing digitalization. Look what's happening today. This conference would have taken place in person in previous years. Now it's effectively taking place digitally. The third area, and I think the previous panel covered this in a nice way, public-private partnerships advanced healthcare in a significant way, I think are here to stay, and collaboration is now acceptable between companies to advance the public's interest. And the fourth is tremendous innovation in healthcare products. In fact, it is said that innovation is significantly driven by necessity, and necessity, therefore, is the mother of innovation. With that in mind, Kevin, please give us some thoughts on any of these areas that you think drove your company and your decision-making as a leader during this remarkable period in the history of the world. Kevin, please.
Thank you, Stanley. You covered a lot of ground in those remarks, and I agree with you 100% with all those four themes. And no one prepares you for a pandemic, and I would tell you that right off the bat, we decided to have very, very focused priorities as a company. First, to protect our employees. Second, to serve our customers. And third, to conserve cash and have financial discipline. And we really amplified that throughout. And when you focus first on protecting your employees, that means that other things will suffer as a result. And we decided that was the most important thing. It was the right priorities. And then serving our customers, we have businesses like trauma and stroke, neurovascular, that never stopped. Our reps had to continue to go into hospitals and provide care throughout the entire pandemic, even in the month of April when many people were at home. And so having clear priorities and really from a leadership standpoint, we had to communicate more than I've ever communicated in my life. So I was doing weekly global broadcasts like we're doing now to all of our employees, reinforcing those priorities, making decisions about, do we have to shut some production lines? we did decide that we had to do that, but we decided to wait for the entire month of April and not furlough any employees, because we were watching the television and seeing all the people standing in lines for unemployment, trying to get online. And we said, we have the financial strength. We can at least hold them for a month so they don't have to worry about standing in lines, because standing in lines created risks of actually contracting the virus. So those were the types of decisions. How do we support our salespeople who don't have access to the OR for hip or knee replacement? So financially providing some level of support so they knew that they could sort of be able to survive for the next couple of months until the procedures came back. So all of these are very empathetic, caring leadership support that we had to show. And a company that's a hard-charging, growth-oriented company, we had to show a softer side to our employees as leaders. Be more empathetic, spend more time listening, spend much more time communicating. Our mission and values is very, very strong, and that was sort of our North Star. Our mission is together with our customers, we're driven to make healthcare better, and our values are integrity, accountability, people, and performance. And we just magnified that. We actually brought a lot of customers, surgeons, hospital administrators came on to our global calls. We had a global call every 2 weeks. And we had for the month of April and May, and then now we've moved that to once a month. But we brought customers to share what are they experiencing on the front lines. And that really provided a lot of comfort to employees to understand that there is a light at the end of the tunnel, that we can deal with this pandemic. But it was difficult. I would tell you, our second quarter, we reported our results. We were down 24% sales versus the prior year. As a growth company, that's not something we were accustomed to. But it also brought out some innovation. So we launched 3 products that we would never even have thought of before the pandemic. One was the emergency relief bed, a very low cost bed that could be assembled on site, that could be stored for stockpiles. That was designed and developed in 10 days. Incredible. We've never done that in our company. Now, of course, the FDA helped us. They have what's called emergency use authorization. So they gave us emergency use authorization. So sometimes the regulatory process in our business slows us down from an innovation standpoint, but the FDA was terrific for that. We even developed a product that would cover the patient called emergency relief patient cover, so that when someone's trying to transport somebody in a stretcher, the caregivers don't get close to their face and don't contract the virus. And then we also have PPE. We make us PPE really for the people in the operating room, but there was such demand for PPE that we decided to approach the FDA, and they gave us authorization to be able to have that product available for frontline employees in a non-sterile manner. So these were all very agile, quick development things that we were able to pull off to actually help rally and support the frontline caregivers during the pandemic. So just a couple of examples.
Wow, Kevin, certainly the collaboration with the FDA, the public-private partnership to get new products is commendable. And of course, the innovation, the new products, fantastic. So let me just explore one a little bit deeper, one of these areas. What about, and you touched on it, the expectation that business is required to be much more involved in society in general. Many refer to this as ethical capitalism, stakeholder capitalism, and the notion that it is not good enough to be focused on your shareholders, your employees, your investors, even your suppliers of raw material and products, but it is important for companies to be engaged in advancing society, the betterments of society, in this particular instance, dealing with a virus. Any particular thoughts?
Sure. I would tell you that I've always been a believer that we have a responsibility as CEOs of companies to broad stakeholders and not just the shareholder. I was a member of the Business Roundtable that signed on to the new purpose of a corporation, which we just launched, celebrated the 1-year anniversary. It's already been a year since we launched that. Frankly, our companies have been performing that way for a long time. And I think now the expectation, though, is that we talk about it a lot more. The millennials they want to hear our stand on moral issues. The racial tensions that have occurred in the United States, we've seen companies speak out about it much more than ever before. Inside our company, we had days of understanding where we had people come together and actually share what this meant to them and how our company may not be stepping up and living in the way that it should in certain areas. It was really enlightening for our leadership. And so I think this is an imperative. And to me, this is not new, though. this idea that we have this broader responsibility. I think the fact that we're talking about a lot more, really coming out as a business roundtable to say that, and that was a large number. We had about 200 signatories to the new purpose of the corporation. It was the first time it had been rewritten to include the multi-stakeholder view. And a pandemic just magnifies how important that is, that we really have to be taking care of our employees, taking care of our customers, taking care of our communities. And then, of course, if you do all that well, the shareholders will also be taken care of. And this is just, to me, common sense. But the fact that there's now this expectation that we talk about it more, that's new. That's sort of different. The fact is we were honestly behaving that way for a long time.
So I agree with you, Kevin. I think there is an expectation now by society, and I might add, the ESG movement driving accountability and measurement of accountability for particular indices that may or may not have been the purpose of the company when it was founded is really, really much more important than ever before. And coupled with the notion that it is expected that CEOs speak out on moral issues today. It's not good enough for a CEO just to keep quiet. I think these are the real big issues that have come to light in the last year and been accentuated and magnified by the virus.
I 100% agree. I think ESG is not a fad. It is here for the long term. And initially, I would say the last 3 or 4 or 5 years, the E was the big focus on environment, on climate change. And I think what we're going to see in the next few years is we're going to see the social part be a bigger focus as it relates to racial diversity, as it relates to many, many aspects. I think they're all going to be important. And governance, of course, that's always been important and that'll continue to be important. But I believe ESG is here for the long term. We're going to start to see more standards in terms of how we report, because one of the big challenges is there aren't today, clear standards on reporting. There will be expectations of our employees that we share. What are our racial diversity statistics? Do we have goals? Are we showing improvement? And I think that type of transparency is going to be demanded. And frankly, it's something that I would embrace as a CEO. I think we should be transparent with all of our stakeholders, and we should be willing to speak out and share our commitment in these areas.
That is really exciting, I think, Kevin, because as a leader in healthcare, I think your views will go a long way. And the notion that companies have a purpose that is beyond economics and that CEOs are going to talk out on issues that are relating to society in general is very, very encouraging. So we don't have much more time, but the other issue that really, I think, has dominated business and much of society in general over the last 3 months has been the increase in the use of technology and digitalization. The fact that actually it is possible to conduct business, to advance the needs of society by video. Obviously, there's a lot missing, and the hybrid of video and personal contact is likely to become the new norm. How did the digitalization impact Stryker and your views?
Yeah, I think it's been a tremendous learning for us. If you could have told our employees that we'd be able to be effective all working remotely, nobody would have believed it in February or January. Even our surgeon and customer engagement has been incredible. So we've been able to do tremendous amounts of training virtually, and this will be part of our permanent offense going forward. Stryker is a very high touch culture, so high travel. I personally did 400 hours on planes last year, which is in the year. That's a lot of time in the air. There's really no reason for me to spend that much time. We will still travel. I'm looking forward to getting back and seeing people. This idea that we're going to do virtual and only virtual, to me, it's not going to work inside our company. Even for training, some of the training on cadaveric training has to be done in person, but a lot can move to digital. I think some benefits of digital is it can be more inclusive. So when I do business reviews, before we would only have people that would fly in for it. Now we can have many more people, like in this conference is a great example. You can have more people attending your business reviews, and honestly, it levels the playing field so that some people who are more outspoken on a video call, they're not more outspoken. And so the quieter people actually have an easier way of being able to have their voice heard. So it's been a leveler. It promotes inclusivity. It's obviously better for the environment not to have so much time on airplanes and cars. And it provides financial benefits that are going to be enduring for our company that we can reinvest into innovation and new products. So there's been a lot of silver linings to this. And I think this whole digitization, we've made a huge leap forward. And even in the healthcare system, even though we don't participate in the teleconsults that doctors have with their patients, that's not part of our business. But this is going to be permanent. I mean, this is something that we've made 10 years of progress, frankly, in 3 months, that we're going to have the use of these virtual consultations for both pre-surgery and post-surgery. So huge benefits to people, to the healthcare system, and to corporations. So I'm really excited about this. We're embracing it completely. That combined with flexible work arrangements, we're going to embrace that. The idea that you could have people only coming to work 1 or 2 days a month or a week, that for our company was a bit foreign. And now for sure, all of our leaders are embracing it and saying we're going to be a lot more flexible. Obviously, it doesn't apply to our production workers, doesn't apply to people going into hospitals, but it's been an eye-opener and quite exciting for the future.
Well, that's also very exciting. I think it's going to obviously, in the end, help with access to care. More patients will be able to be seen more efficiently with better quality of care. So that's all, I think, a big plus. A topic that has, and we're running out of time, received a lot of attention, and you covered it recently, is the notion of D&I, diversity and inclusion. And I do believe that this whole videoing ability to communicate in a virtual way is going to advance inclusion. Of course, diversity is the goal, but diversity for statistical purposes is not good enough. It has to involve inclusion. How does Stryker go about including diversity in its measurement tools and in its footprint?
Yeah, we have a very big program that we've been working on for years around diversity and inclusion. So diversity, we follow all the same standard practices you'd hear about having diverse slates for candidates, having diverse interview panels, employee resource groups, which have proliferated. We have, I think, 8 or 9 employee resource groups now, which really do promote diversity recruiting efforts. So that brings people into the organization. But you're right, diversity without inclusion will not make the diversity stick. And you'll have people coming in, but they won't progress to senior levels of the company. And so around inclusion, we use engagement surveys through Gallup, and we measure inclusion, and that's really been powerful for us. We also have training, a very exciting training program. So over the years, like most companies, we've had our starts and stops around training, but we developed an internal training program without consultants called Think Twice. And what's great about this training is it says you're not responsible for your first thought, but you are responsible for your second thought and your first action. And what that does is it lets people admit that they have biases. We all do. We're the way we were raised, how we were taught when we were young. But the fact is, let your bias happen, but then step back and think and have your second thought be, well, really, is this candidate an appropriate candidate or not? Just objectively, and then make your first action different. And this training has been profound. And frankly, it wasn't sent from the top. It was designed sort of on a grassroots basis by one part of our company. And now it's just, the pull for the training has been tremendous. So the fact that we were on this journey prior to all of the racial tensions that have occurred has been great. We've made huge progress with women. We still have a lot of work to do in the area of people of color and making progress, but I'm excited about the trajectory, and I do agree that these new ways of working, having a more flexible work environment where not everybody has to go in an office every day, and using more virtual tools will help enable us to be more attractive of diverse populations.
That is also very, very encouraging. I think grassroots ways of dealing with these kinds of challenges are much more effective than a memo from the CEO's office. And at the end of the day, to me, I've learned in the last several years since we've had these groups that what is really important is to be educated, because sometimes we just don't know what the other party, the other side is feeling. And unconscious bias is something that we're not aware of unless educated. So I think we've reached our time limit. Kevin, it's been great to spend time with you. Thank you to the Northwell people for what you're doing for your community. And it's, of course, much more than Long Island today. And congratulations on the best practices that you, Mike, and your team have developed in this period of time. And it's a pleasure working with you. So I wish everybody well, the best of health, and best wishes for the rest of this conference. Thank you very much.
Yeah, thank you.